Yes, vitamin D and levothyroxine are generally safe to take together. But there's a catch most thyroid patients don't realize. Vitamin D itself doesn't block your thyroid medication, but one of its most important jobs is helping your body absorb more calcium from food. And calcium absolutely does block levothyroxine. So if you're taking vitamin D, levothyroxine, and a calcium supplement, the supplement everyone worries about isn't actually the one causing the problem. As a pharmacist, this is one of the most common points of confusion I see with thyroid patients. People hear that calcium, iron, and magnesium can interfere with levothyroxine, and they assume any mineral-related supplement carries the same risk. Vitamin D doesn't. It's fat-soluble, not a mineral, and it doesn't bind thyroid hormone in your gut. The major reviews on levothyroxine interactions don't list vitamin D as something you need to separate from your thyroid pill. Here's what is worth knowing. Vitamin D's role in the gut is to help your body absorb more calcium. That's a big part of why people take it. So vitamin D on its own with levothyroxine, no problem. Take it whenever fits your routine. But if you're also taking a calcium supplement, that calcium still needs to be spaced at least 4 hours away from your levothyroxine. Vitamin D doesn't cancel that rule. The calcium timing window applies regardless of whether you're taking vitamin D alongside it. One thing many thyroid patients don't realize is that low vitamin D levels are common in Hashimoto's disease. That doesn't mean vitamin D treats hypothyroidism or replaces levothyroxine, but it is one reason your doctor may check both thyroid labs and vitamin D levels. There's also a dose ceiling worth respecting. At very high vitamin D doses, well above the standard daily amount, blood calcium can climb over time. The symptoms of that can actually mimic thyroid problems: fatigue, palpitations, weight changes, brain fog. So if you start a high-dose vitamin D regimen and suddenly feel off, it's worth checking not just your TSH but your calcium level too. So if you're stacking levothyroxine, vitamin D, and calcium on the same day, here's the routine I walk most thyroid patients through. First, take your levothyroxine right when you wake up, with a full glass of water on an empty stomach. Wait 30 to 60 minutes before breakfast or coffee. That part doesn't change. Second, take your vitamin D with a meal that contains some fat. Breakfast, lunch, or dinner all work. Vitamin D is fat-soluble, so it absorbs significantly better with food than on an empty stomach. Third, if you're also taking calcium, keep that calcium at least 4 hours away from your levothyroxine. Vitamin D doesn't change that requirement. And finally, if you're starting vitamin D for the first time, especially at higher doses, it's reasonable to confirm your TSH is still in range at your next scheduled lab check. I've got the full timing protocol, including how to handle vitamin D, calcium, iron, and magnesium together on the same day, on LiveHealthyRX.com. Link is right below this video, and if this was helpful, consider subscribing. I cover supplement and prescription drug questions like this every week.